Hi, good afternoon. My name is Anthony and I'm from the Respiratory Care Department. So, can I ask for your complete name and date of birth, please? Okay, very good. So, I'm going to wash my hands with the alcohol-based sanitizer. So, would you mind if I'm going to go beside you as I will assess you first by listening your breath sounds and getting your heart rate, respiratory rate, and also your checking your level of saturation. Can you take a deep breath for me, please? Very good. Okay. Continue. Okay. Okay. Very good. Okay. So, okay. So I'll just have to double check first your ID band for confirmatory purposes, and then I'm going to get your heart rate, and I have here a portable pulse oximetry to check your level of saturation. Okay, so I think we're done taking up your vital signs. So the reason why I am here is because the doctor ordered a breathing treatment. There will be 3 different breathing treatments that I'm going to give you. So first is I'm going to administer medication through a small volume nebulizer. So I'm going to use a nebulizer through a compressor base. So the medicine that the doctor would give you is albuterol or Ventolin. So the frequency is every 4 hours. So the reason why we're given is because it would help you relieve from your dyspnea and also help you mobilize your secretions. So this one is the medication inside. So as you can see, I'm going to attach this on the side with a compressor-based nebulizer. And then once we're going to start, you have to do a normal breathing, just relax. Put this one inside your mouthpiece with your tongue here below. Do not obstruct your tongue in here. And then once you do normal breathing, you have to do also occasional deep breaths. Sounds good? Okay. So are we gonna start now? Okay. So put this one inside your mouth. Okay, do normal breathing through your mouth. Very good. With occasional deep breaths. Okay, continue normal breathing. So I think we're done already administering this medication. So I will just allow you to rest for at least a minute while I'm preparing for the next breathing treatment. Okay, so I think we're done waiting for resting for at least a minute. So the next medication that the doctor will give you is through a dry powder inhaler. So the medication that I will give is a salmeterol or Servant. So it was ordered twice a day. So as you can see, this is the dry powder inhaler. So all you have to do is, I'm going to guide you first, is as you can see, I'm going to twist this one until you hear the click sound. That. And then once it's ready, you have to exhale all your air out away from the device. So try to observe it. Once you feel your lungs are empty, so you have to put this one inside your mouth with your lips sealed and then your tongue below to it. And then once you're ready, you have to inhale deep. And then hold your breath for at least 10 seconds or as much as you can. And then once you're done holding your breath, remove the device away from you and exhale normally. Okay? So when we start, so this one, I'm going to guide you. Going to twist this one till you hear the click sound. That. And then exhale all your air out away from the device. And then put this one inside your mouth with your lips sealed and your tongue below to it, and do not obstruct. And then once it's done, I'm going to count 1, 2, 3 and do a deep inhalation. Very good. And hold your breath for at least 10 seconds. Okay, almost done. And remove the device and then exhale normally. Okay, very good. So I'm going to allow you to rest or wait for at least a minute, so while I'm preparing for the last breathing treatment. So now that we're done letting you rest for at least a minute, the last breathing treatment is meter dose inhaler. So this one is corticosteroid, and then the medication that I'm going to give is Symbicort. So it is has a frequency of twice a day. So it is similar to the previous inhaler that I gave you, but this one comes in a form of a liquid dose compared to the previous one, which is a powder form of medication. So this one is the meter dose inhaler. So you position your index finger on the top, as this will be your guide to press or actuate the canister, and then your thumb here below for support. So prior to that, you have to shake the device for at least a few seconds, and then at least prime at least one dose away from it. And then after that, you exhale all your air out away from the device. And then once you're ready, you have to put this one inside your mouth. And then once you put this one inside your mouth, your tongue should be below to it. Do not obstruct the mouthpiece. Okay? So once we're going to give an actuation, I'm going to count 1, 2, 3, and then you're going to inhale deep and hold your breath. Okay? So put this one inside your mouth. So prior to that, I'm going to shake it first, by the way. And then prime the dose. And then exhale all your air out. And then put this one inside your mouth. Okay, I'm going to count 1, 2, 3. 1, 2, 3. Inhale. Hold your breath. Almost done. Hold your breath. Okay, move the device and exhale normally. So I just after I already gave you this medication, because it is a corticosteroid, I'll just give you a glass of sterile water. You have to gargle it. Do not swallow the water. And then after you're done gargling it, you have to spit the water again. Very good. So before I will assess you and check your vital signs, can you inhale deep and do cough for me, please? Okay, very good. So I'll just have to reassess again. Listen for your breath sounds and also your other vital signs. Can you lean a little bit forward? Okay. Okay. Okay, very good. Inhale again, please. Very good. Very good. So we'll just double check again your heart rate and also your level of saturation via portable pulse oximetry. So I think we're done taking up your vital signs. So is there anything else I can do for you? I can just leave you this call light here. You just have to press this red button in case of emergency, if you need some assistance. And then I'll just adjust your real beds. Make sure that your bed are insured, locked. Okay, I'll just give you also another glass of water in case if you're thirsty. Put it inside your bedside. Also, I'll just adjust or make you more comfortable. So if ever if you need some help, just don't forget to press the call light, and then we will respond to you as soon as possible. Thank you so much for your cooperation and for this day.